Okay. Okay. Hello, everyone. I just wanted to come on. I didn't have a chance. My phone is about to die, so I didn't have a chance to actually record with my phone. So I just decided to go live. I had some questions left in my comment a couple of days ago about the best route as far as for nursing as a nursing student, whether or not to do the LPN route or the RN. And so I just wanted to come on and just answer a few questions in regards to that. And if you have any more questions or comments, you can just leave them in the just down below, and I'll get back to you, and we can do an additional live or video in regards to whatever your question may be. Okay, so first I'm going to start off with a licensed practical nurse or a licensed vocational nurse. And that term, they're both the same, they're interchangeable, but the LVN is mostly used in the states of Texas and California. So, where do most LPNs work? Most LPNs work in healthcare facilities. They work in hospitals, doctors' offices, and nursing homes. An LPN provides routine care. They observe patients' health, and they assist the doctors and the nurses with taking care of patients, as well as talking with patients and their families in regards to their condition. So another setting that LPNs provide care or work in are private care, and they provide private care for sick or injured individuals. And they also can work in businesses like with corporations as health consultants for employees or customers. And then the final place where you can also see LPNs in the work setting are state and federal agencies. And in these agencies, they are also consultants in regards to health related issues, programs like community outreach programs. They work with those, and community initiatives. So ways to, an example could be diabetes may be like it may be a outbreak in a certain area, and a lot of people may have diabetes in that area. So an LPN could work with the state or federal agencies as as an outreach program to help with the initiative of getting information out to the population so that those numbers could possibly decrease in that area, if that makes sense. And then they can also be health educators and just bring about awareness, as I was saying. And then if an individual is an LPN, they can also use that with, like they can go into medical coding, medical billing. You can work in medical call centers, customer service, and insurance sales is another place where an LPN or a LVM may work. I hope that makes sense what I just said. And then I also want to talk about the salary. So the average salary right now of an LPN is $50,000 per year. So on average, that's like $24 an hour. And 2020 data shows that LPNs were making over $65,000 per year, and that would be $31 per hour with a 40-hour work period, 40-hour workload. So it is a growing need based on, everything, the pandemic and everything else that's going on in society. So I think the question was asked, would it be better to do the LPN route or go on, stick it through and do the RN? The LPN route is good you if financially, if you need help with getting through school, or you want to get your feet wet, you want to get the experience, because I feel like an LPN, you'll definitely have the work experience prior to continue, if you want to continue the registered nurse route. So now we'll get into registered nurses and their salary and their job description and what they can do and all of that. So registered nurses, just like an LPN, are seen in a variety of health care settings. So you may see RNs, registered nurses, in hospitals, healthcare clinics, rehabilitation facilities, care homes. So they could be hospice care, home health agencies, etc. And they provide medical support to doctors and patients. Registered nurses, they oversee CNAs and LPNs and LVNs. They're able to organize patient charts. They perform and evaluate diagnostic tests, and they work directly with patients, families, and doctors. They do wound dressings, administering meds. These are similar to just like what an LPN would do. So dressing wounds, administering meds, and they also aid the doctor in medical procedures. So that's kind of the difference between an LPN and an RN as far as what additional things that they're capable of doing. So you can also work as a nurse basically without being a full RN. So let's say you have a nursing degree, but you haven't completed your testing. You could still work as a school nurse, telehealth nurse, research nurse, a legal nurse consultant, a forensic nurse consultant, a case manager, and a health coach. So these are things that you can do, I guess, in the midst of transitioning while you're still a student. On average, a nurse will make over $36 per hour, and they normally see about $11,250 in overtime pay per year. So with a nurse within the nursing field in general, it's always a plus to have additional skill sets, so specialties and etc. So if you have these specialties, a public health degree adds an additional, they make a 56.22% more than just a RN just outright. So you do want to have additional backings and certificates and things to ensure, especially if you like to work with special populations, to ensure not only you're making a difference, but you are bringing in substantial income. Okay, so an area in the U.S. where nurses make a decent amount of money is mainly on the West Coast. And I saw that in a data report on the Nursing Journal as the areas in which they make the most money, the regions. It says 63. And another point I wanted to put out here is that 63% of RNs in the U.S. think that their salaries are enough for the cost of living in their area. So 63% of nurses feel that they're making adequate amounts of money to sustain their living in their area. So that's why it's always best just to continue your educational journey. Like, don't ever stop. Does she feel like, okay, I got this, this is it? Or I'm going to just work in this type of setting forever. I feel like with a nursing career or nursing background, you have many opportunities and many different avenues of which you can provide care and be of assistance, but also not get burnt out and still make an income and make a decent amount of money for yourself and your family. So, of course, I'm going to finalize with the highest paid nurse and the least paid nurse. As I'm stating in this video, the more education you have as a nurse, the more finances you're going to make. You can still make a difference as a CNA. You can still make a difference as an LPN. You can still make a difference as a certified nurse, registered nurse, anesthesiast. Am I saying? I get that messed up all the time. You can make a difference in whatever you're doing. But the more education you have, the better. But if you, as I was stating, if you want to get your feet wet and you want to get a feel if nursing is for me, if this is what I should be doing, then you should definitely start off. Of course, I think in most states now you have to have a CNA 1, but you should start off as a licensed practical nurse or just have some type of work experience in working with people if this is what you want to do. But I think this will conclude my video for today. Please comment, like, subscribe, and let me know if this was beneficial to you, if it helped you in any kind of way, and if it answered any of your questions. So, all right, love you, babes. Bye. Brielle.